Here are 3 things you need to know about hyperbaric oxygen therapy. So the way that we breathe oxygen normally is because our atmosphere is pressurized. So what that does is that drives oxygen into our cells, which get transported by red blood cells into the target tissue. How that differs with hyperbarics is that now we're pressurizing an environment to change the way that that oxygen is delivered and absorbed. So now, once we go into this chamber, we don't need red blood cells to transfer that oxygen. It can freely dissolve right into the target tissue, meaning that you're gonna get up to 20 times more delivery and absorption of oxygen. The second thing is these chambers are very, very safe. First of all, we're operating mild hyperbarics, and the key differentiating factor is that these are ambient chambers. So what we're doing is we're pressurizing them with the same percentage of oxygen that we have in our environment, 21%, and then your child is gonna be breathing 100% oxygen through a mask. That massively enhances the safety profile. And the third thing is, how can this help your child with neurodevelopmental needs? Well, in the typical neurodivergent child, there's hypoperfusion in the frontal lobes, meaning that there's not enough oxygen getting to these areas. The second key feature is that if we do have areas of neuroinflammation or even difficulties producing energy, what we want to do is really enhance that with, again, hyperbaric and increasing the perfusion of oxygen. So our brains need oxygen, fuel, and stimulation to function, and supplying that oxygen need is going to be massive for the tools that we already utilize in clinic.